Good afternoon and welcome to our Behavioral Health Talk series today. We are so excited to launch this series. We are going to have monthly series that range from behavioral health topics such as Autism Spectrum Disorder to psychiatry services, and to really bring to our community an understanding more of the services that we offer here at Children's Hospital. So we are looking for upcoming sessions that will begin at 12 p.m. as well as 6 p.m. and some evenings to cater to some of the availability of our community and some of our patient families that we serve. So we look forward today to launching this series, and I'm going to turn it over to our wonderful providers today.
All right. Hi, everybody. Thank you so much for joining us today. We will all sort of introduce ourselves, I think, as we start talking, just so you know who each of us are. My name is Dr. Sarah Miller. I'm a licensed psychologist and board certified behavior analyst here at the Autism Center. So just a quick overview of what we're going to be talking about today. First, we're going to introduce ourselves so you know kind of who we are, and then we'll do an overview about autism spectrum disorder. Even though most of the people here are already familiar with autism, I think kind of going over a quick overview can be a nice refresher of how to describe the condition to other people whenever you're talking with people who maybe aren't as familiar about what's going on with your child. We'll give a quick overview of services that we offer here at our center, and then we're going to spend the majority of the time talking about feedback and questions that we've gotten from caregivers. So we, for most of you guys who responded to register, you were asked to submit questions ahead of time, and so we have divvied those up across ourselves that we'll spend most of the time talking about today. All right, so first, just a quick kind of refresher on autism and what it is. So autism is short for Autism Spectrum Disorder. People will also use the term ASD as a abbreviation. So when you hear us talking about Autism Spectrum Disorder, ASD, we're talking about all the same thing. And for the diagnosis, there are two core areas that symptoms show up in, and that's really important in being able to distinguish autism from other concerns like anxiety or attention deficit hyperactivity disorder or something like that. So we'll talk about those core areas now. The first area is difficulties with social communication. So this is not just language, but it's all the stuff that goes into having a back and forth interaction with somebody else. So the first area of social communication is problems with back and forth conversation or communication. So this could look like in a very young child, maybe them not responding to their name when they're called, or maybe only rarely responding to their name, kind of an inconsistent response. Sometimes parents of very young children might think that their child is deaf because they don't respond to their name when they're called, but then they'll notice that they respond to other things that they really like. You also might see in a child who has more language that maybe they talk on and on and on about their own interest, and they don't really pause to let the other person respond and have that kind of back and forth dynamic to the conversation. So the conversation might feel very one-sided or feel like they're kind of talking at you. And then you also might see that they maybe kind of miss some social cues. So you might see that, you know, they're not noticing when somebody's kind of trying to talk or looking like they're wanting to respond to somebody, or they might not notice when people are looking kind of bored and like they're just waiting for them to be done. And so that's some of that stuff that can interfere with that back and forth interaction. Another area we can see difficulties in social communication is in the nonverbal behaviors that we use during a social interaction. So these are things like eye contact, using your gestures, and your facial expressions. So gestures are things like nodding your head to show you're listening, or talking with your hands. It was this big, it was this tall, I ran really fast. So a lot of children with autism may not use those gestures, so they might be completely absent, or they might be sort of different in the sense of maybe they're not very integrated with their speech. They're not using them at the same time that they're talking, or they're gesturing and talking, but they're not looking at you. They're kind of looking all around. So the nonverbal things can be either completely absent, or they can just be that they're not very seamless or don't happen as often as you would expect. You can also see difficulties in reading those gestures and facial expressions from other people. The third area in social communication is difficulty with understanding relationships or making and keeping friends. So again, this can look very different across different kids. For some kids, they may simply not really be interested in playing with other kids. They might like to kind of play by themselves. So you might see early on in daycare that they're kind of pulling their toys off to the side and playing by themselves and looking perfectly content to not have any other adults or children playing with them. Or you might see that the child is interested in playing with other kids, but maybe they have some difficulty with doing so. So they might be trying to start an interaction with another child, but they come on too strong, right? So they just run straight into the group of kids and they don't notice that they interrupted the game and now the game is messed up because they're just trying to join. And so for that reason, they might come off as not being able to successfully join whenever they're trying to, or they might come off as maybe, for lack of a better word, a little awkward at times. So they might kind of stand right there at the group and not really participate, but they might not notice that they're not being included in the group. And then another area that we can see, especially in young children, some signs of this differences in relationships is in their play. So the way that toddlers and babies learn how to build relationships with other people is mainly through playing. And so a lot of times you'll see some delays in play skills where maybe they play with toys not the way that they're designed to be played with, or they play with toys in only one specific way and they don't play back and forth with other people. So that's everything on the social area. The next area that makes up kind of that core second area is repetitive behaviors or interest and sensory differences. So there's 4 different areas that symptoms can show up in here. And for children to get the diagnosis, they have to have at least 2 of these areas. And so this is another way that you can see a lot of differences across kids, is there can be this mix and match of symptoms here. So the first area is different or repetitive behaviors that they do with their body or their speech. So this could look like things like rocking back and forth or side to side, spinning in circles for a really, really long period of time. So most kids spin around and move around, but this would be kind of going on for a long time or hard to interrupt. Or you might see some hand flapping out to the side or in front of their body when they're feeling upset or doing things really tensely where they're kind of holding their fingers in different ways. You can also hear them echoing other people's speech. So this would be an example of repetitive speech where you say something like, all right, bud, let's get your shoes on. And they go, shoes on, just kind of echoing back, not really having a conversation, but echoing what they hear. Or you might hear them repeating things they've heard before at a later time, but not really in context. So they might start repeating things they've heard from their favorite TV show, but they're not doing it as a conversation with other people. The second area you can see repetitive behaviors is with difficulties with changes in routines or schedules or expectations. So again, this can look very different, but it could be something like insisting that things stay the same. So you come home, you've rearranged the living room, you love the way the couch looks over against the window instead of on the wall, but your child is having a meltdown because the furniture is different. That would be an example of insistence on sameness. You also can see very, very selective eating, where maybe they only eat foods from certain groups or with certain colors or textures. And you also might see that the child might refuse things that look different. So if the food is broken, they might not eat it. They will only eat it if it looks perfect. Or if you take a different route when you're driving, they might get really, really upset and have a hard time tolerating that difference from the expectation. The third area you can see repetitive behaviors is with unusual or unusually specific interest. So this could be a fascination with something that you wouldn't expect a child their age to be fascinated with. So getting really, really into non-toy items when they're little, or researching certain topics and knowing tons and tons of information about it. Or you can see a fascination with something that might be expected for their age, but is to such an extreme degree that it gets in the way of life. So, you know, maybe a child who loves trains, but they won't play with anything that is not trains. They have to take a train everywhere they go. And also, if they ever see a train out in public, they have to go up to it and they can't, you know, move on to walk past it. So this would be an example of how those interests could maybe get in the way of life for families. And then the fourth area is sensory differences. So children who have autism can be either overreactive to sensory information or underreactive. So if they're overreactive, that can be that they're very sensitive to lights or sounds or textures. You might see that they cover their ears or scream or cry whenever something happens that's kind of a normal daily sound, like a toilet flushing or a blender or blow dryer, something that maybe is a little loud, but that most people are able to tolerate just fine. But for them, it seems as though it's way too loud for them. And then you can also see sort of the opposite, where they might be really, really interested in sensory information. So they might look at different things from different angles and kind of peer at them out of the corner of their eye to look at it. They might rub things on their face or their lips, kind of exploring things differently. Or you might hear them listening to sounds over and over again. So they're watching a YouTube video and they pause it, rewind 15 seconds, watch that clip again, rewind again, watch it. So you might see them kind of repeatedly listening to certain sounds. So that's kind of the core areas that make up ASD. And throughout the rest of the talk, we're going to reference these areas a lot, which is why we wanted to kind of give that overview, because all of those symptoms are things that cause impact on family life. A few other quick facts about autism that I think are helpful to be able to share with other people when you're talking about your child is that autism is estimated to occur in about 1 in 54 children. So it's actually a pretty becoming a more common diagnosis, which means that there is greater awareness and better recognition that these children are needing support. Autism is also 4 times more likely to be diagnosed in boys than in girls. And there's a lot of different reasons for that we don't quite have time to go into today, but it is more likely that a boy would receive a diagnosis of autism than a girl. Autism can be diagnosed as early as 18 months. And this is really, really important because sometimes the diagnosis gets delayed. People want to wait and give time for things to develop or the child to mature. But autism can be identified very early on in children, and the diagnosis can be pretty reliable for the majority of those children, even at that young age. And the reason that's important is because early intervention makes a huge difference in the child's life in terms of their learning new skills. When kids are little and they're babies, their little brains are all moldable and ready to learn. So really maximizing that early intervention time makes a big difference in terms of impact on the family life. So that's kind of the overview. I'm going to kick it to Dr. Boggs now, and she's going to talk a little bit about our center.
Thank you very much, Dr. Miller. My name is Corinne Boggs. I am a licensed psychologist here at the Autism Center, and I'm excited to be with you all today and very excited to see so many folks attending with us. We've been looking forward to this, so thank you all for joining. As Dr. Miller mentioned before, one of the most important things when we're talking about autism is early identification and early diagnosis, and that's one of the things that we really focus on here at the Autism Center. So I want to talk a little bit about what we offer here. The first thing that we offer is comprehensive diagnostic evaluations. These are, they consist, and we'll talk a little bit more about this as we go through the presentation. They are comprehensive, meaning they are meant to help children access a variety of services early. We have a fully virtual option that was developed in the last year as a result of the COVID pandemic and the restrictions associated with that. So we do have a fully virtual option for children aged 18 months to 3 years. And then we have a hybrid blended option, which consists of a combination of video visits and in-person visits. And this is an option for children aged 3 through 21. We do serve children aged 18 months through 21 years. Like Dr. Miller mentioned, the diagnosis or ASD can be identified as early as 18 months, and the diagnosis can be reliable at that time. So we really want to make sure if there are concerns that kids are getting in and getting looked at early to make sure that they have access to the services that they can benefit from. The other thing that we have here at the Autism Center is behaviorally based family consultation and parent training. In this service, we address concerns with behavior, feeding, sleep, toilet training, social skills, the kinds of things that kind of get in the way of life for kids with autism and their families. And our model is very much a family consultation and parent training model, which means we work closely with the caregivers to help their kids learn these skills at home. Let's see. Now we are to the caregiver feedback and questions part of our presentation. So I'll ask all of our panelists to turn their cameras on so we can see all the folks who are going to be answering your questions. And as they do, they will introduce themselves. I think Dr. Miller is going to take the lead on this for a moment. I will also let you all know, those in the audience, I do have the Q&A portion pulled up. What we'll do is go through, we have some questions that were submitted in advance. And then as we get to the end, I will pull from the question and answer section as you all type them in. So thank you so much. Dr. Miller.
Great. So as we mentioned, these are questions that you guys likely submitted, or other families who have children with autism. And so the first question that was asked is, what is a comprehensive diagnostic evaluation? Why is it important?
So I will take that question since I just talked about comprehensive diagnostic evaluations. It's kind of a mouthful, but it is deliberate, and it's really important to know. A comprehensive diagnostic evaluation covers lots of different areas. So we're obviously looking at autism symptoms as our main focus, but we're also looking at things like developmental functioning and cognitive functioning and daily life skills, what we call adaptive functioning, emotional, social functioning, behavioral functioning. And the reason that we have the model here, and the reason that a comprehensive diagnostic evaluation is really important, is that it leads to access to services. In Louisiana in particular, Medicaid requires that children have a comprehensive diagnostic evaluation that consists of very specific parts in order to access ABA, which stands for Applied Behavior Analysis, and that is the most evidence-based intervention that we know of for treating the pieces of autism that most significantly impact life. And so in order for kids to access ABA, they need to have a comprehensive diagnostic evaluation. The kinds of measures that are included also give scores that can help children access other supports and services that they may need or may be eligible for, including supports and services through the Office for Citizens with Developmental Disabilities, or OCDD in Louisiana, Social Security, disability, supplemental income. All of those things can potentially be accessed with the data that's part of a comprehensive diagnostic evaluation. That was a very good question. Thank you to whoever submitted that one. Looking at the questions that caregivers asked, and one of the things we asked you all to let us know when you were waiting for an evaluation, what you wish that you would have known, what might have made it easier. And parents said things like what other services were available. They wanted to know about resources and what the future would look like, what options are out there for helping their child, and what sorts of things they might be able to access for their kids at a young age. So we'll kick that to Dr. Johnson, I think.
Yep. So hi, I'm Dr. Corinne Johnson, and I'll be trying to answer those questions with a couple of different options. So in terms of available services and what resources to look for and what options there are, one of the things that's really helpful if you have a young child, so somebody between 0 and 2, not yet 3, is early steps. So that's something that either when you're talking to us, somebody here, one of our lovely front desk ladies, they have this information they can help you with where to go in terms of that. Your pediatrician would also be able to help with that. So letting you know, like, there's a point of entry, and that means this is who you would call in your area to kind of get early steps for your child. And that's something that we would encourage you to do if your person is little. So if they're younger than 3, early steps is who they can go to immediately to kind of get some of those services, as long as they have like some kind of delays or they're meeting some of the early steps criteria. If they're a little bit older, trying to, and we'll talk a little bit later about the school evaluations and a school evaluation versus ours, but it might also be the case that some of the bigger kids are eligible for some services through their school district. So another thing to go to is if your child is 3 and over, then going through their school district to see if they're eligible for some services there. So they may not be able to get some of the services that Dr. Boggs talked about yet because they haven't had that comprehensive diagnostic evaluation that we would give, but they might still be eligible for those kinds of resources in terms of early steps or the school system. Other things that we love are books. So there are some like really helpful books that will tell you some things that you can do with your child while you're waiting. Dr. Camps is going to Vanna White for me one of the books that we love. Thank you, Dr. Camps. An Early Start for Your Child with Autism. Thank you, ma'am. And that's one of our favorites for if you have a little person. It gives you some tips of things that are evidence-based strategies. So strategies we know will help you that you can do with your little person to help them, pay attention to you more and possibly communicate more, and use some of those other social communication skills that Dr. Miller talked about that are delayed when you have autism spectrum disorder. Another one is like social rules for kids. So these books are not specifically geared towards like you have to wait for a diagnosis, but this just tells you some rules that we might pick up on because we don't have autism, but our kids might not get. And so that kind of gives you a foot in the door with some things that you can practice with them while you are waiting for, what is the first book? Dr. Camps, can you hold it up one more time? And it's called An Early Start for Your Child with Autism. And the first author is Sally Rogers, PhD. So there's some others, but if you're in Amazon or Barnes and Noble and you Google An Early Start, or that'll give you the information. You can't all see it. Oh.
Dr. Camps, I think you need to talk to make your video show up for people who are watching
guys.
it on their
Thanks.
phone.
Is this any better? Sorry, y'all. Otherwise,
I'll put it in the chat.
Yeah, I was gonna say we can type the title in the chat.
Yep. I'm typing it in right now.
Thank you guys for asking. Yeah, thank you for mentioning it and saying you guys couldn't see. That didn't dawn on me when I asked Dr. Camps to be my Vanna. So social rules for kids was one, and An Early Start for Your Child with Autism. Dr. Boggs just noted it in there. Those are some of our favorites in the beginning. And then we have some other books that we'll talk about, like once you get an evaluation, that are helpful when we know for sure that your child has autism. But these books will be helpful for you whether or not they meet criteria for the diagnosis in terms of like helping them to do some of those social communication things and working on some social rules. Other things that might be helpful are some of our online. The other book that was mentioned is Social Rules for Kids. So the top 100 social rules kids need to succeed. And I hope you guys can see that over my face.
I'm going to type it.
Dr. Boggs is typing it too.
You can probably hear me typing, sorry.
You're welcome, guys. So other things that you can do are some websites that are helpful. And if you're Googling autism, all kinds of stuff is going to come up, and that might be a little overwhelming. One of our websites, a website that we like, we're not in charge of it, so I won't say our, is the Autism Speaks website. And so at autismspeaks.org, they have some helpful toolkits. And so those are things that you can download based on a specific topic that is of interest to you. So there's a toolkit on challenging behaviors or toilet training or sleep problems. So some of the same things that we might help you navigate once we are doing some of those parent training services with you again. But in the meantime, that gives you some information, some things that you can do. They also have a resource guide, and that's something that you can connect to even through the children's website. So if you're at chinola.org and you /autism, there are some links that you can kind of go under, and I think it's under like parent resources. And one of them, hey, and you guys are adding them in the chat. So they have some toolkits, and they also have resource guides. So places in your area that might be also helpful in some services that you can attend or receive. Exceptional Lives is another one, and Dr. Boggs noted that in there. And then another helpful resource that's going to be in your area or based on your area is something called Families Helping Families. And they are super helpful. So they are region based, and that means there's going to be one in your area. So you guys can like Google them to find the one that's closer to you. You can follow the one that is in your area or the other ones. Like it's not going to hurt if you want to follow them on Facebook. They'll post on their Facebook page some helpful things, workshops that they're doing or things that are happening in the community, or it's like sensory friendly day at the zoo. And so you have a heads up on when there are some community activities activities happening, but also if you're specifically reaching out to them, they can help you navigate some resources as well. So if you are having a hard time with a school district not necessarily recognizing you, think some of the things that you're saying as a concern, or you feel kind of overwhelmed, because some of those meetings are overwhelming when it's you and 10 other teachers, and you just need like somebody to help be a support for you, they can possibly help with that. If you just have some questions on things that are happening in the area or some other possible resources, they would be able to help with that. So they're also a really helpful resource that we like to suggest to families as well. And that's also going to be noted. Thanks, ladies, for noting all the things below. So you guys should also be able to see that in the chat area. And I think those are the main things that I was thinking of, and anybody else can feel free to chime in, or Dr. Miller can take us away with the next question.
All right, great. Thank you so much, Dr. Johnson, and thanks everybody for interacting with the chat. So the next question is for Dr. Camps, and the question is autism the same as a learning disability?
Yes, thank you all. My name is Dr. Jody Camps. I'm also a licensed clinical psychologist here at the Autism Center at Children's Hospital, and really happy to be here today and have the opportunity to talk with y'all. I think this is an excellent question. So autism spectrum disorder and learning disabilities or delays can commonly co-occur, but they are in fact different things. And so when we do evaluations here, we always look at both areas. So again, a lot of the activities we do are dependent upon the age of the child. So if we are meeting with a younger child, we will ask questions about a child's developmental skills in different areas. So again, things like communication, daily living skills like feeding oneself, helping get dressed. For older children, we also look or use a measure related to cognitive functioning, which is basically a child's thinking skills. So it can be common for signs of autism spectrum disorder to co-occur with either delays or delays in development or delays in cognitive functioning, but they don't always co-occur. And so I think sometimes, again, it can get confusing, particularly for families. The latest statistics, I believe, show that about 44% of children actually have typically developing thinking skills. So just because you have signs of autism doesn't mean that you are automatically going to have delays in either developmental skills or thinking skills. But again, the importance of doing a comprehensive diagnostic evaluation is to look at both areas to help guide treatment recommendations. So this is a great question. One thing that's also important to note is that, and again, another area that we always ask families about is something called adaptive behavior, which is basically how is the child doing with different daily living skills. Delays in that area. So even with a child who might have typically developing thinking skills, it can be common for children with signs of autism spectrum disorder to have delays in adaptive behavior or daily living skills. And that can be an area of focus for treatment. And so that particular group of skills, again, is important to predict a child's long-term functioning. And if there are delays in that area, then it can be important to get help for those particular types of skills. And so if anyone else wants to jump in, please feel free. I'm going to pass it on now to Dr. Miller, who said that one of the questions she is handling is, parents said they wish that people knew kind of how to handle children with autism and not provoke them. So Dr. Miller is going to provide some helpful input for that area.
Okay, great. So I'm going to answer this both a little bit thinking about from the caregiver's perspective, trying to learn how to yourself not provoke your child, and then also other people, kind of interacting with other people who you feel like might be kind of doing that. Because we also had a similar question that was, how do I handle my child with autism when they are in a rage? So when they're having that kind of meltdown and having a hard time, what do I do? So first and foremost, I want to say that this is definitely something that in therapy, somebody can work with you directly on. So that applied behavior analysis, ABA therapy, is a wonderful treatment for how to help figure out what is kind of triggering this difficulty for your child, and then what you can do and what other people in the child's life can do to help them tolerate it better and help them learn, you know, whatever skills they might need to help them manage that situation. So definitely know that this is something that can be addressed in therapy. It is something that can be improved, but it is more common for our kids with autism to have, you know, people call them all kinds of different things: meltdowns, tantrums, being in a rage, you know, having a fit, whatever it is, basically having some behavior that makes it hard for you to do the things that you're trying to do. So the first thing is to kind of try to learn what the child's triggers are so that you can predict when it's going to happen. Obviously, you're not always going to be able to predict it, but for a lot of families, they know taking them to the grocery store is a disaster. So then you can know that anytime you go to the grocery store, you need to kind of plan ahead for what to do for your child. And then if you can get an idea of what helps calm your child down, sometimes those are things that you can do ahead of time to help them tolerate it better. So if you know your child has a favorite toy that, you know, helps them kind of stay calm better, then maybe making sure to bring that toy with you to the grocery store, or setting up a really nice routine for how something happens can help your child be able to predict what's going to happen better. So again, if we go back to that thing of one of the symptoms of autism being kids wanting things to be exactly the same, having a hard time with changes in routine, sometimes if we create little routines of how we leave the house, how we come back from school, what we do when we go to the store or to the doctor's office, that can be helpful. It's also a good idea to get comfortable with sort of advocating for your child when you're going to other places. So this would be kind of related to when you feel like maybe other people are doing things that are problematic for your child and are triggering that difficulty. Talking to people ahead of time about your child's needs and maybe any specific modifications can be a really helpful way to help head off that difficulty, right? So say you know that your child hates it when somebody touches them without talking to them first and telling them what they're going to do, right? So I'm thinking of you go to the pediatrician and the pediatrician is talking to you and checking their heart and listening to their belly and whatever, you know, and the child is maybe having a really hard time because they weren't expecting for that stethoscope to be on them. So sometimes just kind of letting people know, hey, if you can tell him what you're going to do ahead of time, let him touch it first, then he'll do better with letting you do it. That can be a helpful way to kind of head off that problem. And it's okay to ask for modifications. It's okay to, you know, tell people, hey, my child has autism, and because of that, he or she has a difficult time with this thing. So can we kind of modify that, or can we go a little slower with that? You know, this is also important for schools, is working really closely with your child's school team in terms of what you know kind of helps your child in those situations. There's also a really, really great resource that Dr. Johnson already mentioned for some of those specific triggers on the Autism Speaks website with those toolkits. The toolkits have different information about how to handle common triggers for kids who have autism. So getting your blood drawn, going to the dentist, getting a haircut, how to handle meal times, all of those kind of things that are more common for kids with autism to struggle with than kids who don't have autism. Autism Speaks has put together these really nice toolkits. They're usually about 5 to 10 pages, and they are designed specifically for families of strategies that you can do at home with your child. I think of them as like a first line of defense type of thing. They're kind of general behavioral strategies that might really help things go more smoothly. And then if you try those things and you're still finding that you're not able to do things that you need to do in your daily life because your child's having a hard time tolerating them, that would be kind of a good sign that a therapist would be a sort of a next step of making individualized recommendations for you. So that's everything kind of for that one. And the next question is for Dr. Boggs. It is, why don't all the schools recognize autism?
That is a great question, and it is one that we hear pretty frequently. I think this is a really important area for clarification. So I'm really glad, super glad that somebody asked that question specifically. So the schools, technically, schools are obligated to serve children and address anything that has an educational impact. So any symptoms that have an impact on their educational functioning. And they are in Louisiana, bound by what's called Bulletin 1508. So that is a document in the Louisiana law that talks about how kids might be eligible for extra supports and services in school. So it's very much about educational impacts. It's within the school system. It's not the same as a clinical diagnosis. So if a child has been evaluated, for example, through the public school system, they may be eligible for supports and services, but that doesn't equate to a clinical diagnosis unless that evaluation was done by somebody who also practices outside of the school system. A clinical diagnosis or a medical diagnosis is one that's provided by somebody who is licensed to practice outside of the schools. It's a qualified healthcare provider. In the Louisiana Medicaid guidelines, it talks about who kind of fits in that category. And the difference is a clinical or medical diagnosis is based on the current diagnostic criteria that's based on best practice and what we know about the diagnoses, or the diagnosis, excuse me. And that serves to access a wide variety of services. An evaluation through school is really based exclusively on finding out if a child meets criteria in very specific areas as defined, by Bulletin 1508, which is that big document that's in the Louisiana law. There is a category for autism in Bulletin 1508, so it is possible for kids to have a school plan with that label or that category with that exceptionality, but the criteria are different from the clinical diagnostic criteria. So it is possible, and it happens at times where kids have a clinical diagnosis but may not have a school plan in the same category. So they may have a school plan in a different category, like ADHD, if they also have co-occurring ADHD, which is not uncommon. In fact, it's pretty common. Or they may have a plan based on developmental delay. So if they're under 9, they may have a school plan in the exceptionality category of developmental delay, even if they have a clinical diagnosis of autism. It can be confusing because you're having an evaluation and somebody gives you results and at the end of it, there's a name of something. The name of something is different depending upon who's doing the eval, or it means something different. So if it's done through the school and it's really exclusively just looking at educational eligibility, then it's bound by those categories. At times, there are clinicians who do evaluations for schools, and they may also provide a clinical or a medical diagnosis, but that's separate and above and beyond that evaluation that's looking just for the educational eligibility. One really important thing I do want to mention here is that the rules for evaluating and supporting children in schools, children with any sort of special needs, that's governed by law, and there are particular rights and responsibilities of all parties involved. The Families Helping Families resource that was mentioned before is a really great organization to talk to if you have any questions about your child's plan in school, if you're having difficulty getting a plan for your child in school, if they have a clinical diagnosis but you're having difficulty getting supports, if you have any concerns about whether or not your child's needs are being met in the educational setting, the Families Helping Families folks have educational advocates that are amazing. They know all the rules, they know the acronyms, they know the numbers and the laws and where to find things, and they're really good at helping parents navigate what can be a kind of difficult and intimidating process, I think, at times. So it is really, really important to have support as you go through that, and I want you to know that it's important for us that you all know that there are options to help you go through that process. Anybody else have anything to add on this topic? I know it's a question that we get asked quite a bit.
I would also plug again the Autism Speaks Toolkits.
Yes.
They have a toolkit on the IEP process,
Yes.
which is the Individualized Education Program for Special Education. It's 80 pages long. So it's very thorough in terms of kind of addressing the different steps and the processes. And even though things are a little different state by state, there are a lot of national laws that also govern special education. And so that toolkit is really, really helpful for kind of guiding parents through the different processes and the rights.
Yeah, there's also in that same section, there's a toolkit it says for the school community, and it's really designed. Did you mention that one already, Dr. Miller? You mentioned the parent one. There is also one for the school team. that parents can take to the school team, to the IEP meeting, if your child has an IEP, if you're trying to get an IEP, it kind of lays out suggested accommodations and modifications. It gives some empowering information to the school team if they're trying to figure out kind of how to make a plan for the kids. So those two really complement each other well, those two toolkits. Thank you for reminding me about that and all of this. Everybody good with that topic? Any other additions? Okay. The next question is for Dr. Camps, and this is from a parent who said that they wished people knew that a child can look perfectly normal on the outside, but that can cause issues because of the difficulty that lies below.
Yeah,
Dr. Camps.
Thank you. I think this speaks to an important issue about kind of when and how to notify folks that your child may have autism spectrum disorder. And so I think in general, one thing that I think is really important is that as that child's parent, you know your child best, and you can be a really incredible advocate for your child. Again, there are lots of ways to do this. There's a lot of personal decision making involved, but oftentimes it is helpful to notify folks. And I think, again, there's lots of different ways to do this. So sometimes it can be a simple, my child has autism spectrum disorder. He's having a rough day. You don't need to get into a really long presentation about the signs and symptoms of autism spectrum disorder. Other times it may be appropriate to do that. And again, there's lots of different ways to do this. Again, Autism Speaks has some reading material about how to share information with people like family members, if that's something that you feel like you need assistance with, and how to talk about that. I think I actually saw something in the chat, which I think is a great idea. Some families might carry, for example, a little identification card and can hand it to somebody if you're out in public. But in general, I think it is important to note that as the child's caregiver or parent, you play a really important role in advocating for them. And so there's lots of ways to do that. Oh, I'm
Great.
sorry. Does anybody have anything to add to that?
That was great.
All right, so I'm going to pass things over to Dr. Johnson. So another question that we received was many parents want other people to know that there are so many ranges of autism spectrum disorder. People with autism are not just caricatures, and other people have asked, are there different types of autism spectrum disorder? So I'm going to let Dr. Johnson take the lead on that one.
Hi again. So in terms of, I think this kind of piggybacks off of some of the stuff you were just talking about, Dr. Camps, as well, that it might sometimes be harder to tell when somebody has autism, or, because it is a spectrum. So thinking about it as one diagnosis that is a spectrum disorder, so to say, and that means that we've said this multiple times, that people are going to look different. And just like with anybody without autism, there's no two people that are going to look the same, because that presentation is going to differ per person. But how much the autism is affecting them, or how much we'll notice the effect, that's going to be kind of where they are on the spectrum. So some people are going to, be more significantly impacted, or needing more support for their autism symptoms, and others maybe not, and they might have a milder presentation, or you might not see as many things. Or like I heard a parent describe it one time as like looking into a classroom window, and sometimes you look through and you're like, oh, he looks just like everybody else, and then other times you look through and you're like, oh, that's a little different. And so that's just some kind of way to think about, how the spectrum can look. So the way that we diagnose autism has changed over time. There's a book that we use as psychologists and psychiatrists, and that kind of guides us with what is the criteria for a diagnosis. And in the past, in our old book, before we made some changes, there were different kinds of autism. So you might hear some of those terms still, even though clinically we don't use those anymore for a diagnosis. So we used to have autistic disorder, or pervasive developmental disorder not otherwise specified, PDD-NOS, or Asperger's, and we don't have those diagnoses anymore. So, in terms of just regular conversation, or a layperson, you might still hear those terms, and if you're Googling things, some of those terms might still be helpful for you in terms of gathering information, but in terms of whether or not those are clinical diagnoses, the diagnosis that everybody will get now or give is that autism spectrum disorder, and then we will specify, again, how how much support that individual needs. And then, like Dr. Camps mentioned and talked about earlier, whether or not there's intellectual impairment. So if they have some intellectual difficulties going along with their autism, and their language. So there's not those separate diagnoses anymore. It's all autism spectrum disorder, which really just reflects that it's one continuum of symptoms. So it's a continuum in terms of the presentation of symptoms as opposed to it being some different things. And I think that answers all my questions. Was there anything else, you guys, that I left off? No? Perfect. Okay. Then I'm going to turn it over to Dr. Miller. So Dr. Miller, parents said that they wish they knew that autism can become more prevalent or more clear as their child gets older.
That's a great question. I think it goes really well with what you just talked about in terms of the different levels of autism and the different amounts of support children can need. So because children have different presentations and children can have sort of different degrees of support that they need, and then also because there can be differences in terms of whether or not they have developmental delays or intellectual delays, in addition to autism, that means that symptoms can look really different at different children's ages. So for example, for a child who maybe doesn't have any intellectual disabilities and has language skills that are about what you would expect for a child their age in terms of vocabulary and talking in sentences and things like that, you might not see some of those social difficulties as much until they get a little older, because as they get older, the social situations they're in become more and more complex. So when you're little and you're at daycare, all you're expected to do to play with your friends is to play with your toys next to your friends and not hit them, right? Like it's not quite a whole lot going on. As you get a little older, you're expected to share your toys and take turns with other kids. You might start playing games like playing tag or chase, where there's rules that you have to follow and you have to switch roles back and forth. And so sometimes you might see that a child who maybe didn't have any issues playing in a room with other kids might start to have some difficulty following those rules of those group games, because maybe they always want to be it during tag, or maybe they never want to be it because they hate having to chase people down and catch them. And so, or they might hide in plain view of other people and not notice that people can see them. And so these are difficulties with perspective taking and turn taking that can be difficult for some of our kids with autism, that can then cause some social difficulties that you might not have noticed before, right? So if they start arguing with their friends about how they don't want to be it because they got tagged, that's going to mess up playing with the game and might make it a little harder for them to keep having successful interactions. To kind of move it on a little further, as maybe they turn into teenagers, as you start to get 10, 11, 12, 13, social interaction starts to look more like having conversations, sitting around and talking about different things that are going on at school. It's less play, right? And so then that difficulty with that back and forth conversation, that difficulty with talking about other things that people want to talk about that maybe the child isn't as interested in, can start to become more obvious as the child gets older. So this doesn't necessarily mean that your child is getting worse with their autism. It more means that as they're growing up, the things that are expected of them are becoming more and more complex. And so they might be kind of hitting a little bit of a tipping point in terms of the skills they already have being able to meet the expectations. And these are things that in therapy, people would work on with them, right? So if I'm a child who's maybe having trouble with taking turns and going back and forth with being it during tag, that's something in therapy that we can work on with turn taking and being flexible with rules. You can work on conversations at home with your child with a little bit of structure and support for how to kind of have that back and forth conversation and help your child out with noticing those nonverbal cues from other people when they're looking bored or not wanting to hear what they're talking about anymore. So I think it's really important just to kind of understand that autism is not usually a condition in which people get worse. It is not a condition that people kind of regress in skills over and over again throughout their whole life. There might be very early regressions, very, very early on when the child's a toddler, but usually as they grow older, they continue to benefit from therapy and get more and more skills. So it's not something where we expect for things to kind of like get worse and worse. It's more just that the situations they enter as they grow up look different. And so you can see potentially the autism symptoms showing up in different ways as your child is entering different situations, like going from being in one class in elementary school to now changing classes and having to manage a locker in middle school. Those are very different types of expectations. So it's that piece that really is what often kind of shows up for families in terms of, oh no, now he's really having trouble. It doesn't mean they're getting worse. It just means that they're in a new situation and they're needing more support from other people to learn what to do in that new situation. And then a lot of times what you see is once they learn what to do, you can kind of back off with that support, and then they can kind of follow along with the new things they've learned until they maybe enter a new thing, and then you kind of get that support again and pull it back again. So there's often this kind of back and forth dynamic going on with that in terms of the support you're giving your child, how much you're maybe kind of guiding them on things. This is really related to multiple questions that we got from families, which is, will my child grow out of autism? Is autism curable? And this is a really, really important question. It's something that I'm really glad people are asking, because I think it's really important to know. So for the vast majority of kids who have autism, they will continue to have autism throughout their entire life. There is a very, very small subset of children who sometimes do not maintain the diagnosis as they get older, but the vast majority of children do continue to meet criteria for autism throughout their life. And so the best thing to do is to plan that your child will continue to have autism and that they will continue to need different types of support. What is important about that, though, is that the type of support they need right now is not necessarily the same as the type of support they might need later. This is particularly true if your child is very young. So when we diagnose a child who is 18 months old, 2 years old, 3 years old, 5 years old, it is very hard to predict what that child is going to look like when they're 14, 18, 20, right? What we know is that it is most likely that they will continue to have autism, but the specific way that that shows up for the child in terms of the level of autism, the amount of support they need, is very hard to predict, because thankfully, kids can make amazing progress in therapy. And so I have seen children who weren't talking when they were 3 or 4. They didn't have any words. And then when they were 8 and 9, they were talking, right? So you can't always predict what somebody is going to be able to do when they haven't had therapy yet, and especially when they're young. And so, I think all of us are pretty passionate about, don't let somebody tell you what your child can or cannot do. The most important thing is get your child supports and therapy so that they can do everything that they're capable of doing, right? But part of that means recognizing that having autism means that they might need a little more support or some extra things to be able to meet their full potential than another child who doesn't have autism. And then the other thing that's really important for that is that as your child gets older, turns into more of like an older teenager, 15, 16, 17, that's when it's, pretty reliable that you can kind of start to predict better some of the supports they're going to need, particularly if maybe they also have some intellectual delays or intellectual disability. It can be very important to kind of plan for long-term supports as they enter adulthood in that way. And again, I'll plug Autism Speaks and Families Helping Families for how to kind of navigate that adult process. But I think it's just really important to know that even though we always talk about early intervention, autism is considered a lifelong disorder, and it means that there has to be an individualized plan for how the child and the adult is supported throughout their life so that they can meet their full potential. So I think we are right at about time. Okay, so I think what we'll do then, Dr. Boggs, is go ahead and wrap up if that is, unless you had anything else you wanted to add.
And I wanted to add one thing real quick, if you don't mind, to piggyback onto what you were just saying about the importance of accessing services and getting therapy. And you've heard us talk about ABA, which stands for Applied Behavior Analysis. It's a behaviorally based package of strategies and interventions. It doesn't look like one, it should not look like one thing for everybody. It looks very different and should look completely different based on the person that is being assisted and supported. So it's the principles of ABA, or it's a theoretical framework. Those things don't change, but how they're applied should look different based on the individual. And there are several questions that have popped up in the Q&A and then also in the chat about kind of differentiating behavior versus newly learned things versus kind of questions about education and learning and understanding educational assignments and homework compliance and those sorts of things. I wanted to point out, I know we're short on time, but I did want to point out that all of those things are appropriate targets for behaviorally based intervention. And if you have a question about, one of the questions was about a child with some potential GI issues and whether it's behavior stuff or GI stuff, you can work together with providers. So you can have a behavioral provider working with you and your GI together to try and figure out why things are happening and figure out what to do about it. It's one of the things we didn't mention specifically is that kids with autism, individuals with autism broadly, are more likely to have problems or differences with GI stuff, especially kids can have difficulty with constipation, toilet training, food sensitivities, those sorts of things. So it's pretty common for behavioral providers to work with the medical providers to figure out how to determine why things are happening and then make a plan to address it. So that it kind of emphasizes and I think amplifies the importance of getting hooked up with therapy providers so you can start to answer those questions for your kiddos and get them support. Okay, thank you for letting me take that little add-on sidebar. I think Dr. Miller was going to take the last piece of this, right?
Yes.
Okay.
So the last little thing we wanted to sign off is just some sort of words of wisdom that we got from other families when they submitted their questions. We asked them, what would you tell somebody whose child was just diagnosed with autism? And even though we have spoken all of today, you guys are the experts in your children. And we just got some really, really beautiful words of support from families and wanted to share those as kind of our sign off. So what we'll do is we'll just each take a turn reading the different quotes as they come up, and then we will sign off. And thank you guys so much for attending today. So the first response we got is that it gets better as you get help and support.
Next one is, it's okay to be sad, it's okay to be angry, but don't treat the diagnosis as if it's the death of your child.
Take that one. It's not a disadvantage, it's an advantage. There are strengths too. Once you get you and your child's stride going, it will help so much. Be strong, lots of prayers, faith, and love.
There's hope. Don't feel defeated.
1, it's a marathon, not a sprint. Take things one day at a time. 2, every resource is not the right fit for your child. Look for what works best for both of you.
Thank you all so much for your submissions. Thank you for taking the time to type your questions. Thank you for taking the time to be with us today. We very much appreciate it. This time flew by. This was such a pleasure. Thank you all. Anything else from the panel before we wrap up today? I think, and we did record this. I just want to make sure folks know that Dominique, who introduced us at the beginning, is the in charge of dissemination of information. So our hope is that we'll be able to share this in a way that is accessible to folks, both who attended today and who were not able to attend today. So you can, as soon as that goes out, you can let people know. But thank you again. It was our pleasure. We hope that you all have a wonderful day. Thanks for your participation.
Bye.
Bye, everybody.
Bye, everybody.
Bye.